Every year, 200,000 ACL injuries occur in the world because of sports. Elite athletes are more likely to get an ACL injury by 10 times or to 100 times. Female athletes, however, in high school and college are more likely to get an ACL injury before male athletes. Female athletes have about a 1.5 to 4.6 more likelihood to get an injury. Male athletes, however, are 11.1 to every 1,000th athlete to get an ACL injury. Alright, so your knee consists of your tibia, your fibula, your femur. You have your patella tendon, your quad tendon, your patella, and your ACL. ACL injuries can occur with jumping, change in direction, and deceleration.
So these are some exercises that you can do to help prevent an ACL tear by strengthening the surrounding musculature. So this one is just a prone hamstring curl with a resisted band. You can go up in the color depending on their strength. So do you want to do a hamstring curl? So all she is doing is taking her heel and trying to get it as far to her glutes as she can, and that will help strengthen all of the hamstrings, which is an important part in preventing ACL tear. So the next exercise we're going to do is squats. Squats are great for the quadriceps and the hamstrings. So with squats, you're going to want your athlete to keep both feet on the ground about shoulder width apart. Go to your spot. Go down. Yep. And you can see her knees are not pointing in, that's bad. And she's keeping her chest up. The next strengthening exercise we're going to do is glute bridges. So the patient is going to be in the supine position with their knees about 90. To do it, they're going to contract their core, contract their glutes to get a posterior rotation of the pelvis. You can tell them, pretend like you're trying to put your belly button into the ground, and then all they're going to do is lift their hips up. And then they can hold that for like 3 seconds and then go back down.
The next activity that an athlete can do to prevent ACL injuries is by balancing on one dyno disc to help with their core and their glutes to strengthen them to prevent any injuries from occurring. Another exercise that athletes can do to prevent ACL injuries is how they land when they jump. So they don't want their knees inward. Instead, they want to land with their knees straight and as soft as they can.
This technique that is shown is one way to get full extension back in the knee. All the patient is going to be doing is propping their foot up on a bolster, a pillow, a towel, whatever you have, and they're just going to let their knee hang. So they're just going to completely relax their leg and let their knee hang until they can get full extension. This exercise that is going to be shown is going to be used to help an athlete gain full flexion. So all the athlete is going to be doing is using the heel and dragging it up as far as they can go. They'll hold it there for about 10 seconds, and then they'll slowly push the heel out as far as they can go. They'll repeat this a couple times during a rehab session, just to help get more range of motion in the knee.
Okay, so your ACL consists of your tibia, your fibula, your femur. You have your patella tendon, your quad tendon. What did I say?
You said your